Thank you so much, Dr. Leonard. I'm Ann Ming Ye. I'm one of the pediatric gastroenterologists here at Stanford Children's, and I also help run our pediatric integrative medicine program. Today, we have the absolute pleasure and such a great honor to invite Dr. David Steinhorn, Jana Din, and Al Striplen here today to teach us and also to offer a little bit of healing energy. Dr. David Steinhorn is a pediatric critical care and hospice medicine physician, and he's an adjunct professor at UCSF-Fresno. He's also the pediatric hospice medical director at Fresno, Concord, and Fredericksburg. Jana Din is a former child psychology teacher, and she is the co-founder of the director of the Tao Center of Healing. She's also an amazing shamanic healing practitioner. And Mr. Al Striplen has a master's in counseling and has dedicated his career as a university counselor in helping families of diverse communities and Native American families. He has also been a Native American Studies professor. He is currently a docent at the State Indian Museum in Sacramento and plays the native flute. We are so honored to invite them here today to teach us about where palliative care and integrative medicine intersect with Indigenous healing wisdom in honor of Native American Heritage Month. Thank you.
There will be a slide at the end that has our contact information on it. You can don't have to write this stuff down. And I made the PDF of the handouts available to everybody if they want them. And I guess this will be recorded as well. This is a land acknowledgement that Al made available to me. It's available on YouTube and comes from local people. It runs about 2 minutes, and I think you'll enjoy this. Remember that we're all organic material. We all come from the earth. We're all connected to the earth. Being a grounded human being means being connected with the earth, with the ground. And we take some of those things for granted. Yeah, we also walk upright and we have our heads kind of in the clouds. We certainly do in academic medicine where we're left-brained and think about all of the intellectual sorts of cerebral things. But we're a connection between whatever is up there and whatever is down below us. And I think that that is a very natural indigenous way of thinking about where is my place on the earth, what role do I have? And that is part of the essence of where my practice, 35 years in the PICU in major children's hospitals, and the last 25 of that developing children's hospice and palliative care programs for those children who we could not save, could not salvage from life-threatening illness. And what do we have to offer them in place of more and more and more technology when technology is not benefiting them? That's the origins, if you will, of my work. So here is the land acknowledgement for 2 minutes.
Horshetuhi, Kanakrakat. Good day. My name is Charlene Nijme, and I'm the chairwoman for the Muwekma Ohlone tribe of the San Francisco Bay Area. Here with me today, I have Vice Chair Monica Arellano and former Councilwoman Gloria Aliano, and Muwekma Youth, Isabella Gomez, Georgiana Gomez, Lucas Arellano, and Gabriel Nijme. Today, we will be reading our land acknowledgement on behalf of the Muwekma Ohlone tribe. Thank you and welcome to our ancestral homeland.
Horshetuhi, Stanford University Tashu, Nuperote, Uyakishware, Aye Mani, Hisweware, Butrun Tamien, Wolwolam, Nonwente Muwekma.
I am Muwekma Uyakish, Verona Ban, Alameda County Ta. Ne Shahishu Stekne, Tuhi, Muwekma Ohlone tribe, San Francisco Bay Area Tak. Nepe Ware, Oyo Wetzel, Muwekma Wolwulam, at Verona Bantak, Suyakma.
Makintashu, Nupetita, Muwekmash, Wetel, Palo Alto Tak, Gemenia. Wayente at Oyo, Orto, Horshe Nepeware, Huyu, 1891.
Suyhanimu, Maknuma, Gemenia, Makin, Wayente, Ukshere, Hiti, Aye, Dashu, Irite, Stanford University ta, Achokmamu, Moekma.
Palo Alto tak hemenya, dahe, dashu makware polola, mani mak heme, mani mak ukshere, mani mak skape. Dashu moekma mak isha, mak tuheste, nesha tuhi rotenomo, Palo Alto tak hemenya, aye Bay Area tak, aho.
I mean, all of us, the majority of us in this room come from immigrant or other places. And so we just need to remember and acknowledge that. As the saying goes, those who forget the past are doomed to repeat the same mistakes. And I bring this up. My wife told me I shouldn't mention politics, but in the current political environment that we're in, that we need to recognize our mission in terms of what the thrust of this presentation is going to be, supporting the human spirit. And I'm going to go back to the title slide. Supporting the human spirit allows the body to optimally accept Western medicine. So it's acknowledging the fact that human beings are complex. These are our little bios. You can read them later. This is a disclaimer that says we've got no financial conflicts here. I want to point out that all the modalities we'll discuss, drums, flutes, whatever, energy healing, Reiki, those sorts of things, that these are universal modalities. They're not owned by any one specific ethnicity group or anything else. So this is not cultural appropriation. This is acknowledging the universality of the sorts of things I'm speaking about. And again, for those of you who are hardcore cell biologists, you know, this may not resonate with you, but some of it may. All of us have loss in our lives. All of us have experiences that we can relate to with some of the cases I'll present towards the end. So as I was developing this grand rounds with Justin Baker, we were talking about the multidimensional nature of human beings. And I think that we do a pretty good job with the physical, sometimes the mental, occasionally the emotional aspects of our patients and their needs. But when it gets into the spiritual and the existential, we kind of farm that out to others. We give the spiritual care over to chaplains and other sorts of prelates and ministers of that sort. And when it comes to the existential in terms of why am I here? What is the whole point? Why am I killing myself to become a clinician at an academic health center that I won't be in a few years when I'm done training? These sorts of questions about what's it all about. I mean, it's when I gave a grand rounds at UCSF about 10 years ago, I pulled out the Monty Python title slide from The Meaning of Life. And this really is a fundamental issue. And I'm going to only say that there's a book called From Strength to Strength by Arthur Brooks, who's a business faculty at Harvard in the business school. Talks about the skill set that we use in the first half of our careers will not serve us well in the second half of our career. And for those of us, I mean, I'm a number of years past 70 at this point, and for those of us who are in the second half of our career, and we're not going to get new grants, and we're not going to produce earth-shattering publications, it's important to kind of look at the other things that give meaning to our lives and that give meaning to our careers and the investment that we've all made physically and emotionally and spiritually in our careers. So how does this relate to hospice and palliative care medicine? Because that was a part of all of this. And you can see this circle diagram on the right side of the screen where I have Western medicine at the top. And don't get me wrong, I love Western medicine. I did a sabbatical in the epigenetics of the mu opiate receptor about 12 years ago at Northwestern. And it's really cool stuff. But when you stand at the bedside of a patient who you can't save in the ICU, you start wondering, is there something more? What more can I bring? and then you start searching for those. And when you're up at night as a house officer and you're exhausted and you get yet another admission, you think to yourself, is this really what I spent all of these years trying to do? Is this really who I'm supposed to be? So Western medicine is great, but then there's the whole other aspect of Western medicine that we don't recognize, which brings in the integrative modalities, whether it's massage, Reiki, herbal supplements, traditional Chinese medicine through acupuncture, Qigong, other modalities. And then this concept of transpersonal medicine. Transpersonal psychology goes back to Jung and the concept that there is something else beyond what is visible and present to us in the concrete world that we live in. And what is that thing beyond, and what is my relationship to it? And that's what we've kind of leveraged and worked with in terms of developing this integrative medicine approach, which we're calling transpersonal medicine. I began with integrative medicine almost 20 years ago, a little bit more than 20 years ago at Lurie Children's, used to be known as Children's Memorial in Chicago, where we had a significant philanthropic grant to explore integrative medicine and bring it into the hospital. I saw this as a way of providing for the patients in the ICU that I couldn't care for with Western approaches. But my work has really taken a huge leap forward when I moved to Sacramento and UC Davis in 2012. And Jana, Dina, and I began our collaboration there. What we recognized was that the sort of flute playing that you hear or rhythmic drumming brings people out of their head over a period of time and down someplace else in their body that's not in their head. And this then couples with the idea of mindfulness, which is something that Ann Ming is going to do a little experiential work with shortly. So that the idea of mindfulness is something that we explored, and how to get families out of a panic state sitting at the bedside of their critically ill child and bring them to a place where they could hear in their heart, in their mind's ear, let's call it, what they needed to hear that they couldn't hear when they were all wrapped up in internet searches for there must be some remedy somewhere or some innovative protocol that somebody's doing that I could get my child enrolled in, when there may not be anything out there. And even if there is, the chances of it being successful, as we all know in phase 1 studies, et cetera, is by no means a guarantee. So again, chasing after theoretical, hopeful goals may actually steer parents away from their connection to their child. I guess that's part of the take home, and that being realistic in advising families is critical. I'm going to talk very briefly about mindfulness, that our brain can either focus on the outside world or the inside world, which is a mindful world. That when your thinking goes up, your mindfulness goes down, vice versa. And we need to realize that that's where most of our patients and their families are at. They're in a state of worry, anxiety, fear for the loss of their child, for their child's suffering to no good end. And so that's where I realized that we needed some other way of working with patients and families. The language of the inner world doesn't have words. We get feelings, emotions. Sometimes we get visual images. Memories come back to us, etc. Aha moments where I see things that I didn't realize before. And over time, with these experiences, we get a shift in our understanding. The inner world is a quiet place. It's a place for observation. And if you observe something and try and change it, you will snap out of that mindful world. And you don't have to learn anything because, as many people have said, the human being is wired to be mindful, but our Western upbringing and our Western approach to life often steers us away from that. So I'm going to ask Jana Din to come up here and talk with you about the program that she developed at Galt High School in California. This is so critical, especially for a pediatric audience, because of the enormous mental health crisis that we're facing in adolescents and teenagers. And I'd just like you to explain a little bit about what you did. And then if you hit the arrow, it'll play the video.
Good morning, everyone. When I was teaching high school, I retired in 2019, right before the pandemic. As you know, child and adolescent anxiety, depression, suicidal ideation was already at a very all-time high. I had not seen the numbers that I experienced. And then with the pandemic, it got exponentially worse. And so I brought a mindfulness program to my school district where, using something as simple as drumming to help move the brain from a very high anxiety state, in most cases with the students, to a very calm and meditative state. And so this video will show you just a bit about this mindfulness program.
I lost people in the past, like everybody else. I lost my grandma, and a year later I lost my cousin. And I would hold in that pain to stay strong for my parents and my siblings. But that drumming helped me release that pain I had. I went to the classroom and Mrs. started drumming for us. And I put my head down on my desk and she just started drumming. When I woke up, I didn't know what was going on. I had tears in my eyes. I was crying, and I went home that whole week and I would wake up crying, but it would be like a good crying. I would feel like better about myself.
So just to kind of sum up, what would you say to someone that asked you, what is the purpose for drumming? Why do you do that in class anyway? What would you say is the biggest benefit?
To find a better way to relax yourself and release stress.
To find a better way to relax yourself and to release stress.
To heal your mind and soul.
I like that you repeated that, to heal your mind and your soul.
To bring yourself to the present moment.
To bring yourself to the present moment, exactly.
Why don't we break time?
Okay, that's good.
We may do some drumming later if we have time, but you get the idea. No pharmacology here, just a way for anxious teenagers to kind of settle down in the middle of the day, things like that. And we've used this extensively in the clinical setting as well. And, you know, you might think, wouldn't parents think it's weird to have this person with a drum at a bedside in the ICU? And parents find it very soothing. It's remarkable how effective it is. So Jana was, I guess this was yours, but I'll talk about it briefly. So Vicki Friedenberg was a PhD research nurse in electrophysiology at Children's National in Washington, and developed a program where she brought mindfulness into the cardiology clinic. And her initial cohort was a group of teenage patients where they had very dramatic responses. And she thought, well, gosh, could I create a mindful mentors program and teach our staff how to offer this modality to their patients, whether it's on the ward or in the outpatient setting, or to their families. And so there's a publication you can see that we produced from this, quoted down below. And then early on, I suggested to Vicki that she bring the drumming in as a non-verbal, non-cognitive way of leading people to a greater state of mindfulness. So she actually bought a set of these buffalo drums, and people use these to, again, as I say here in bold, to help move from the head to the heart. And I mean, even the sense of the movement can create an almost calming effect. And this is what we need to be able to do for our patients and their families. I've not been impressed by cognitive behavioral verbal therapies in the hospital setting being effective in truly allaying parents' fears, but I've been quite impressed by how effective these nonverbal modalities are in moving parents to a calmer place. And then also creating ceremony is something that we can do with these modalities, and we'll talk about this in the cases we present at the end. In Vicky's study, she demonstrated that at the baseline, the staff that participated in the study, volunteer participants in the study, had twice the stress level of the average population adults. That 51% met burnout criteria, and that there was a high incidence of work absence. You can see these various scales that she looked at with improvements early on, as well as an improvement in terms of physician wellness and stress after the training, and reduced work absences as well. So this was an effective study. And that really leads us into Ann Ming and her experience with mindfulness as part of an integrative modality.
Thanks so much, Dr. Steinhorn, for a little cameo. We'll do a very brief breathing exercise. Breathing is the best way to tap into your autonomic nervous system. When you breathe in and out, and as you elongate that out breath, that's actually when we tap into our relaxation response. Oftentimes, our stress response is actually a shorter in breath and a shorter out breath. But as you elongate that out breath, that's you tapping into that relaxation response. And mindfulness is really just noticing all the monkey thoughts that are happening in our head and not allowing any judgment, allowing them to pass, kind of like you're noticing the clouds moving through the sky. And I thought it would be nice, especially in light of recent events, to give you all something that you can take with you to the bedside, at home. I use this when my 13-year-old is giving me eye rolls. I use this in the procedure suite when I'm teaching my fellows how to go left on the colonoscopy, no, your other left. And also when I'm at the bedside, when we've been doing some of these integrative medicine consults, it's been really great to teach families this breath. And it's basically called in for me and out for you. So I invite you to go ahead and sit comfortably in your seat. Find your feet flat on the ground and just let those eyes close if you feel comfortable. Go ahead and take a few relaxing breaths and notice your breath in and out. Notice your in-breath nourishing your body, and let your breath find a natural rhythm. Focus your attention on your in-breath. Savor the sensation of the breathing as you breathe in, breathing everything that's good for yourself. Perhaps warmth, perhaps kindness, perhaps compassion. Just feel it. And as you breathe out, notice that your body may feel more and more relaxed and more at ease. Go ahead and call to mind someone whom you love or someone who's struggling and needs compassion. Visualize that person in your mind. And as you breathe out, direct your breath to this person, offering them the ease of your breath, of breathing out, intentionally sending warmth and kindness and something good to that person on your out breath. Now, letting go of what you or the other person might need, focus on your breath in and out. One breath for you, one breath for me. Breathing in for me and out for you. In and out. Just like that. And now I'll invite you to feel your chair underneath you. Blink your eyes open and come back to this room. You know, having a mindfulness practice is as easy as breathing. And if you're in front of your patient and they're in distress and they're anxious, you just breathe in for you, have compassion for yourself, and breathe out for them, bringing compassion to them. Thanks, David.
Thank you. Al, you're going to be up next, and Jana's going to drum while you play too. Are there any wind musicians here? Raise your hand. Oboe? Okay. Who else? Anybody else a wind musician here? Seriously? Nobody played flute or clarinet in high school? French horn, yeah. That's good. So when you're a wind musician, you take a fast in-breath, then you blow out. So if you all pick up a wind instrument, you're going to be able to do your own pranayama or your own breath awareness. And I got this insight from Steve Porges, who, and Ming knows his work well with the polyvagal theory, who really looked at the coupling between the autonomic nervous system, which he refers to as the primitive nervous system, the unmyelinated nervous system, and the respiratory cycle. I mean, it's fascinating stuff. So I'm going to now introduce Al Striplen, who I worked with for a few years, who Jana introduced me to from Sacramento, and ask him to spend just a few minutes telling you how he uses the flute and what his intention is during this. Al.
Mishmi Truhis, Mishmi Naruha, Ganrakat Al Striplen. So I am Amamutsun Ohlone. So we're a little further south from here, from the Muwekma Chochenyo speaking people. So that was the language you heard on the slide this morning. This took me all my life to find those words. My dad was in an orphanage. And so I spent much of my time looking up our heritage and finding out the name, the language, the sound, all those kinds of things. And along the way, I met many amazing people. And I have to give credit for many of them for what I know. What I share with you is mostly from experience. I do have a science background, bachelor's degree level. I taught high school sciences. But I thought I would run into a conflict when I started getting into Native American culture about what I learned in physics and chemistry and all these things. And lo and behold, indigenous populations already knew this stuff. Different names, different labels, and didn't go into the complexities of things that science does. But I learned that basically we're talking about the same kind of thing. What I'd like to do is share a little bit of why I know what I know and why I believe it, because I think talk about a takeaway to take home. I've talked with many people through counseling, I do spiritual guidance, as well as college advising and personal life path advising. But what I find that the words that come out of my mouth, the things that I share, as wise as I think they might be, doesn't do much good if a person doesn't cognize it, if they don't believe it, if they don't trust it. That's one of the big takeaways for Native American culture and the colonization process, that experience, because we lost our stories for many generations on how to understand life. So I basically use that beautiful little circle model that you have on your website that talks about mind, body, and spirit. If we continue around that circle, a creative source is the other quarter of that. So we look at all things physical. We look at the mind that helps us operate our daily life, and the spirit and the source of all things. And if you look at it figuratively, there's kind of like an unsaid divide, two halves of the brain, this and that, physical, mental, and the spiritual and source. And I refer to that little implied line there as the veil. And we're talking about it in different words, as far as that when you think too much, you get out of your spiritual realm. And you can't be too much in the physical realm, otherwise why be to your spiritual realm, otherwise might not operate successfully in our physical life. So we have to have that balance, as a lot of the Buddhist teachings talk about, that middle way. And so we don't veer too far from it if we have our mind clear. And that's the teachings from our shamans, is that the clear mind, you can hear your intuitive voice. And that goes back to what I just said about trusting yourself, trusting what you hear, that if you ask something, and then you'll receive a response. But we've forgotten how to hear and trust that response, which comes from inside. And so where does the flute come in? During the searches of my father's background, the Amamutsun people down around Hollister and San Juan Bautista, he was in an orphanage up in Portland, Oregon. That's how far away he was taken. But at any rate, the flute came in as I learned more about the culture and worked in the State Indian Museum. I learned to play by carrying my flute around and just playing it. And I started realizing it really affects people. And it has steered my life in amazing directions. I've written children's books, initiated by playing the flute. Went to Rome with this guy here and that gal over there. Never thought I'd be playing flute in Rome. I'm here today. In the museum, I meet all kinds of people and talk about the spiritual ceremonies there. And as I did that, the teachings that I had before started falling into place. One other takeaway that emphasizes keeping the coherence of spirit and physicality is our ceremonies have a very, very unique way of expressing the need to have that so-called veil, that separation, as minimum as possible. The dancers actually use big obsidian blades of Northern California, and the dancers go through a cutting motion symbolically, and with their feet, they're kicking back as they're cutting. And what are they cutting? Cutting the veil. They literally use the words. And the implication is that there should be no obstruction between our physical expression and the rest of ourself and spirit. And when that coherence occurs, the oneness occurs, automatically we have health. If we're destined to be a healthful person, because souls do have an agenda when they come into the planet to experience. That's our beliefs. And so we don't get in the way of that if that's the purpose of that soul's experience. But generally speaking, we were designed perfectly to be in complete relationship with our source, with that so-called other side. And then in that is where our health is. I worked with a teenager in a hospital who was had traumatic brain injury. And I went after work and held his hand and talked to his soul or his spirit. He was completely in a coma. And I reminded him that you can go throughout your whole body. And if you want to fix anything as you're traveling through, fix it. You have the privilege and the tools to do that because your body will respond. As you all know, we have those embryonic kinds of energies within us. Some people call them stem cells. Otherwise, they're just energies of some kind. But that process of creation never stopped. It continues within us, where we renew our bodies every so many years. But that consciousness commanding this process is what we're trying to do in Native American spiritual world. We're always in command of ourselves. So at age 81 years old plus, I don't take any medications. My so-called medicine cabinet has my shaving stuff in there and the other stuff you use. So I try to practice what I preach, and anything that occurs to me physically, I use it as an experience. And I let the two come together, reminding my body of what it can do.
Okay, will you play at the end?
Yes. Now or then?
I think at the end.
Okay.
As we're closing out. I don't know if any of you had any impressions when you came in here and Al was playing his flute, but I find it quite touching and moving, and actually it I think plays. You're going to see this. There are a couple of case presentations. I may only have time to do one of them because it's 8:42 already. These are a number of the kids we've dealt with, from Gaucher's to an elderly woman with multiple system atrophy syndrome, to a couple of kids who were brain dead with traumatic brain injury in the PICU at UC Davis, another adolescent with good pastures, pretty unusual, near fatal pulmonary hemorrhage. So we've used this in a wide range of situations, but I consult with a children's hospice program up in Sacramento that was asked to take a child home from the PICU at Sutter Hospital up in Sacramento, a 2-year-old with progressive weakness who ended up having a diagnosis of mitochondrial disease. The family wanted the child to be able to die at home, but the child had failed extubation multiple times after 85 days on the vent. So our goal with this child was to create a celebration of his life at home and to use the flute and the drum. As you can see, both Jana and Al here in the background in the patient's home up in suburban Sacramento. This past July, this was creating an ambiance and an atmosphere for this process. And the child came home with the transport team, was on the ventilator, intubated. I've done over 30 home extubations for children whose families felt it was most appropriate to have them die at home. It's not a far stretch. He came home on a dexmedetomidine infusion, and that was lucky, with a central line, intubated, and everything was secure. And because he was weak and not moving, of course, it wasn't a problem. Here he is in his mother's lap in the home. And again, Al and Jana using the flute and the drum to create an atmosphere, let me just call it an atmosphere, in the room. You know, I once told some parents that I thought that prayers were a way of calling guardian angels down from heaven to look out for children. This was a Christian family. They found that very, very comforting. You have to tailor your words to the family, their belief system, etc. But I do believe that the drum and the flute create something that is very meaningful. So these are the mother's statements that she sent to us by email a couple of months ago. It was more than she wanted, but in such a good way. It was such a beautiful gift to us to do this home extubation. And here's the other important point, and I recognized this in the ICU 10, 15 years ago, that the mother said, I did not know what we needed. Families don't know what they need. But you all who have extensive clinical experience, presumably some wisdom, maturity, etc., because many of our families are much younger than many of us are, they need somebody who intuitively can guide them and anticipate what it is that they need in that moment. And so I thought that this was very insightful on her part. As far as this goes, they had two other children, their two other sons there. They had extended circle of friends, maybe 40 friends or so, many of whom had their own children present, grandparents, etc. And his mother said the shared experience helped them to be open about their grief. They had a common experience that they could talk about. They could talk with their kids. You remember when the flute player did this, that, or the other? Do you remember what it felt like with the drum there? So it's really important to include children of all ages at a developmentally appropriate level. That's always something for our pediatric palliative care team to consider in caring for children and their siblings in this whole process as we create the ceremony or the ritual surrounding the end of life of the patient. And Jana, you're going to be up in a second, so you should come up here, please. The other statement was how much peace it had given them because it felt so right in the moment for all of these people. And I can tell you, I spent a couple of hours there before the child got home with the transport team, and all of the friends and relatives who were sitting in the living room and in the backyard, they were really worried. They thought this was going to be something horrible, something ugly, something to be feared, etc. And so what they had was this experience of something very different. So I'm going to let Jana talk a little bit about the flute and the drum in this end of life experience.
So most people really did not know what to expect when we were starting to play the flute and do the drumming. But as we all know, during the 9 months in the womb, the heartbeat is the first universal drum beat. And so that is what really started affecting everyone. You could tell they all started looking towards Al and I. Different. This isn't what we were expecting. And so then they literally, you could see everyone start to calm. So I'd like to just play this because some of you walked in and maybe you didn't hear the drumming. I'm not sure whether I actually want to put on the microphone. I'm going to try doing it without first. See how the drumming could be loud, it could be medium, it could be very soft, almost whisper soft. And so when I am drumming for patients, after a few minutes, you can visibly see people start to relax, their face starts to soften. And that anxious state, that kind of unknown state of not knowing what to experience or anticipate, kind of melts away. And so I worked with over 1,000 clients and patients over the last 25 years. And so everyone, no matter what religious background, what economic background, how well educated or maybe not so educated, everyone responds to that. Okay. I'm not sure.
Oh, okay. All right, so 8:50 right now. We're going to go through the last. Notice this quote: "Drumming in the flute brought the energy into our home that we all needed." I think that these are very profound statements, unsolicited, open-ended questions to the family. This wasn't a one-off. This was a child who had been through the Stanford UCSF system with infantile gauchers that Jana and I worked with, I guess, about 10 years ago. And you'll see these quotes as well. You can read them on the handouts, etc. But they're struggling to figure out when to disconnect the ventilator, allow the child to die, minimally responsive state. And when she felt in my heart, she had the courage to let the child go. And so again, this was a shift. And Jana had worked with them several times in a chronic care facility. So the closing thoughts are that integrative medicine strives to care for body, mind, emotion, spirit, and social context, because human beings are in a social context. This is true for adults. This is true for children. I mean, our school-age children who are no longer part of their peer group, the adolescents who are in the hospital and lose connection with their peer group, they have significant loss and suffer grief over these losses. So I think that these modalities that are very common in the Indigenous world are things that do have a role and a place. They don't depend upon words. They don't depend upon educational level or semantics or anything like that. They just depend upon the human being's intrinsic ability to shift into a state of quiet inside. And then in that place, as Al said, the veil, the separation between the here and now and what we would consider in Western society kind of ethereal woo-woo stuff, but which has an impact on people in ways that we have forgotten after Descartes in the Age of Enlightenment, etc. If you want to talk afterwards, we can talk about that separation of body and soul, and St. Thomas Aquinas, etc. Because this lies at the heart of where we find ourselves now in Western medicine, trying to bring things back together. Anybody here remember the Jim Henson Dark Crystal? Anybody else? Oh, you guys, you don't know what you've missed. Anyhow, this represents the splitting of the physical and the more ethereal metaphysical, and the need to bring it back together. So I will stop here and we'll take questions.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.